morning, Dr. Stephen Hopkins. Good morning.
Hi, thank you.
Here to talk about the free screening of varicose veins again.
That's right. I want to talk a little bit today about lower extremity swelling. Last week we talked about varicose veins. I'm going to touch on that a little bit as well. Go over venous reflux disease and a lot of different things you'd be surprised causes lower extremity swelling. One of which is venous reflux disease, and I'm going to show you a little movie about that and kind of go over some things that we're going to talk about at our free vein screening event. It's going to be this coming Saturday on the 15th of September at Melon Face Diner. It's at noon, and everyone can just call our office. It's at 256-9499 for an appointment, and I'm going to kind of go over everything with regards to veins and venous reflux and then give individual consultations.
Now, doctor, how many people suffer from any type of vein problem?
You know, varicose veins and venous reflux disease is extremely common, and in the country, U.S. is about 25 million, so it's an extremely prevalent problem.
Yeah, that's quite a bit.
Okay, I think Tommy has that video queued up, and we'll send it away, Tommy.
We would like to demystify lower extremity swelling. There are 7 causes of lower extremity swelling: heart, lung, kidney, and liver disease, as well as lymphedema, medications, and what is called venous reflux disease. Now, heart disease or congestive heart failure causes lower extremity swelling. It also causes shortness of breath, and oftentimes the neck veins become distended. Lung disease also can cause swelling. Sleep apnea is one of the most common but yet unrecognized reasons for lower extremity swelling, as is other lung diseases. Liver disease is depicted here. There's a normal liver on the left side and an abnormal liver or cirrhotic liver on the right side. The more the liver becomes diseased, the more likely one is to get lower extremity swelling. Kidney disease is also one of the most common reasons for swelling of the legs. The kidneys eliminate waste and also regulate fluid. Because of this, when the fluid is not regulated properly, the legs tend to swell. Medications, especially blood pressure medications, are frequently culprits for causing swelling of the legs. Hormone treatment and also what is called non-steroidal anti-inflammatory medications like aspirin can frequently cause swelling of the legs. Lymphedema is when the small lymphatic channels that drain fluid from our tissues into our veins become disrupted in some way, and this results in swelling. Venous reflux is really the most common reason that people have swelling of their legs. As you can see, venous reflux is caused from a defective valve or more than one defective valve in the veins, causing distension of the veins. As it turns out in our bodies, when things in our bodies are distended, it causes symptoms. These symptoms include bulging veins or varicose veins, aching, pain, heaviness, tiredness, fatigue, itching, burning, restless leg type symptoms, and as you know, swelling. Now, all of these symptoms are typically worse with prolonged standing or sitting. And these are really the most important symptoms to remember that frequently are caused by venous reflux disease. This is a depiction of various types of vein problems. We have reticular veins, which are the small blue veins, varicose veins, which are the larger tortuous veins. These frequently are associated with the symptoms as mentioned above. And then, of course, we have the swelling, and this is from the reflux disease mentioned before. When venous reflux disease becomes fairly significant, it will also sometimes cause venous stasis ulceration, as depicted below. Now, ultrasound is the way we diagnose venous reflux disease in a modern phlebology practice. It has become what we call gold standard for diagnosis of venous reflux disease. These ultrasound examinations are all performed in our office and are very convenient and are completely painless. The treatment for this condition is essentially delivering heat to the vein And when the vein is warmed up, it shrivels or shrinks down, collapses, and allows the blood that used to flow in the reverse direction to flow through multiple collateral vessels into the deep veins, which have healthy valves and bring the blood back to the heart in a much healthier fashion. This is a very simple procedure performed in the office under what we call local or tumescent anesthesia. It is almost always covered by insurance, and patients' symptoms of aching, pain, heaviness, itching, burning, and swelling are usually either significantly improved or eliminated completely.
We're back live in the studio with Dr. Stephen Hopkins of the Lode Vein Institute. And again, you're going to have that free screening coming up.
That's correct. It's going to be at Melon Phase Diner at noon on the 15th, and just call our office, 256-9499. And actually, we're also, if you can't make that date, because I heard there's a lot of things going on that time, you know. We also are having a screening event on Wednesday in our other office in Sonora, and our number there is 532-5528, and that's going to be at the Peppery Restaurant. So we're having 2 vein screenings, and either one you can call the office and make an appointment, and I'll do the lecture and give individual, you know, consultations. And I hope that I've educated everyone on what causes swelling and edema of the legs, one of which is venous reflux disease. That's a treatable thing, so I'm glad that everyone was able to learn a little bit about that today.
And that's legs, starts
Lower,
in your legs?
Yeah, starts in your legs, and there's a lot of different causes, but the venous reflux is one of the most common reasons.
Great. And if you feel that you are having these symptoms, they should talk to their doctor or get to you.
Or just call the office, make an
Call
appointment, or come to the vein screening event, either way. We just want people to know that we're available here in the Mother Lode. No more vein stripping procedures. That's a procedure of the past, and look forward to treating people.
Good. Very good. Thank you very much, Doctor.
We're going to head to an ad break. We'll be back for the closing of the show after these
You're
messages.
watching Amador County's #1 news and sports leader, TSPN.